So when to do RFA? So RFA is actually probably mostly what is being used to treat Barrett's. Yeah, we're talking about resections, the tip of the iceberg. I think most people are treating dysplasia and Barrett's with RFA. Why? Because it is not so difficult as resection, doesn't require so much experience, it however can cause real problems if you are treating some of the things that you've seen today with RFA. So try not to do it. So when should you do it? ESG says you should do it when patients with low-grade dysplasia have had at least 2 separate endoscopies, both of which have been dual read by experienced pathologists, and I think I should probably say separated by a period of time on PPI. Then RFA is indicated, or that endoscopic ablation for Barretts Oesophagus with confirmed high-grade dysplasia without visible lesions. How does RFA work? Superficial mucosal damage, superficial tissue necrosis, and allowing normal squamous epithelium to regrow in the place of it. What types are there? There's the classic RFA, heat generation, and they look like this. There are different types. There is the through the scope, there is the 60, the 90, the ultra, and the balloon. This is circumferential ablation. So what is the evidence that RFA works? So eradication of intestinal metaplasia. It's interesting that you completely get rid of intestinal metaplasia, and you would think that to get rid of Barrett's, you have to get rid of intestinal metaplasia, but it turns out that actually that is not really the most important endpoint. The most important endpoint is getting rid of dysplasia. And the indication to treat is dysplasia. So that's getting rid of that is the indication to treat. And it's very effective. It's very effective, but it does have a recurrence rate. And as we discussed previously, this can be treated with ESD. The most common side effect of RFA is stricture formation. So if a patient's had RFA and they call you up as their gastroenterologist a few weeks later, potentially the cause of that calling you up and saying, I'm having real pain and I'm having problems swallowing is a stricture.